Hello friends, I am Dr. Sanjay Jain, practicing physician in Gwalior, Madhya Pradesh. Today is the World Heart Day and it is celebrated and observed annually on September 29 each year with the aim of increasing awareness of cardiovascular disease, which include heart disease, stroke and hypertension. This is created by World Heart Federation, and this day informs people around the globe that CVD is the world's leading cause of death, claiming around more than 20 million lives each year, and it highlights the action that individual can take to prevent and control the CVD. So on this occasion, let us learn about the role of healthy diet and healthy lifestyle in the treatment and prevention of hypertension, which is one of the CVD. Hypertension, as you all know, is also called as blood pressure, and blood pressure is the pressure which is exerted by the blood when it is flowing in the blood vessels, and when the pressure is increased, it is called as high blood pressure or hypertension. Normal blood pressure, as you all know, is 120 to 140 systolic and 80 to 85 diastolic. In healthy persons, BP does not remain constant throughout the day. It tends to rise and fall throughout the day. It may have no warning signs and symptoms, and many people even do not know that they have got high blood pressure. This high blood pressure damages blood vessels and increases the risk of several conditions like heart attack, stroke, and kidney failure. Thus, it is frequently called as silent killer, and so we should take measures to control the high blood pressure, and there are several ways to control, to treat, and to prevent this hypertension or high blood pressure. For the treatment, there are a number of safe, effective medicines, and all those having high blood pressure should take these medicines honestly and regularly prescribed by the physician and keep the blood pressure under control. For control and prevention of blood pressure, lifestyle and diet plays a very important role and may avoid, delay, or reduce the need for medications. Certain dietary approaches like DASH diet, which is called as diet approach to stop hypertension, and Mediterranean diet, they have been engineered to reduce the high blood pressure in patients with hypertension. Let us see what are the features of these diets. The number one is reducing the salt intake. So the sodium, which is present in this salt, sodium chloride, it should be consumed in a less amount, less than 2 grams per day. And the foods which are rich in sodium, they should be avoided. And you should avoid canned food, processed foods, junk foods, and fast foods also. In fact, the less sodium you eat, the better BP control you might have. So you should eat less amount of sodium in your diet. Now, second thing is eat more of fibers, fruits and vegetables, as they are very high in potassium and magnesium, which are useful in controlling blood pressure. Do not, I must say that you should eat whole fruits and whole vegetables, and also nuts, seeds, legumes, and poultry, which are also good source of magnesium. These items, they tend to control your blood pressure. Best fruits among them are strawberries, blackberries, blueberries, and raspberries. Apples, pineapples, and papaya also are good foods. So this is about your fruits and vegetables. You should eat more of fruits and vegetables in your diet. Now, the third point is limiting the alcohol intake, because excess intake of alcohol increases blood pressure. You should limit your alcohol intake. Fourth and very important point is smoking. You should stop smoking completely, because smoking is a very dangerous risk factor for hypertension and cardiovascular disease. The fifth factor is cutting down your number of teas and coffees, because these tea and coffee contain nicotine and they tend to increase your blood pressure. So you should not drink more than 1 or 2 cups of tea or coffee in a day. Now the sixth factor is cutting down your desserts, sweetened beverages, red meat and processed meat, because they all also increase the risk of development of diabetes mellitus in hypertensive patients. The seventh important factor is about fat-rich foods, because fat-rich food increase the cholesterol, that is cholesterol, triglyceride, and LDL, which are called bad cholesterol, which are harmful for your heart. And by decreasing this fat content food, you can improve your HDL, which is called as good cholesterol. So these can be worked as a successful tool in weight management. By reducing this cholesterol fatty food, you can also maintain or you can also reduce your weight, which is also help us in reducing or controlling our blood pressure. Now coming to the lifestyle, along with the diet, we should also exercise, walk every day so as to keep our blood pressure under control. Aerobic exercises are are beneficial. We should do at least 30-minute exercise in a day, at least 5 days in a week. Important exercises are brisk walking, running, swimming, cycling, playing tennis, or jumping rope. So if you have good this lifestyle management and diet plan, you can control your blood pressure and you can be away from all these cardiovascular problems. So to conclude, to prevent the heart disease, you can eat healthy, get active, go for exercises, stay at a healthy weight, quit smoking and stay away from these second-hand smokers, control your cholesterol and blood pressure, drink alcohol in moderation, and manage your stress and avoid unnecessary stress. So this is all for today. Bye bye, namaskar, and take a good care of your heart.